Okay, welcome to this chronic injury revision video. As always, I really encourage you to make sure when you're revising you do so with the specification really close to hand. Make sure you're referring to it to ensure that you're covering all the detail that is required. So today's video is going to focus on chronic injuries. Those are injuries that result from continuous stress on the body, and we're going to have a look at soft tissue injuries and hard tissue injuries. So chronic injury definition, really important. A chronic injury is a slowly developed injury. It's slowly developed over a period of time, resulting from continuous stress on the body. It's often associated with overuse. And again, the whole of that definition is really important. We need to be able to state in our definition, and if we were to describe a chronic injury, when it happens and what it's being caused by. And the same is true with acute injuries. So chronic injury, when it happens, well, it's slowly developed over a period of time. What causes it results from continuous stress on the body, so often associated with overuse. Some general examples of chronic injuries: shin splints can be brought on by too much running on hard surfaces, so they're really common in long distance runners, and particularly those that are maybe not professional long distance runners, but those people that are trying to work up to maybe a half marathon or a marathon. Tendinosis of the elbow, or tennis elbow, commonly referred to as tennis elbow, also really common in any sport where we've got repetitive movements like tennis, like golf. Tendinosis is a common chronic injury. Although in the definition there it talks about chronic injuries being associated often with overuse, they're also brought about through maybe incorrect technique, repetitive strain, a sudden increase in training loads, incorrect or reduced recovery. So as we start to maybe implement progressive overload and maybe reduce the number of rest days, if we do that too quickly or too much, we might bring about a chronic injury. Poor range of motion and a lack of a warm-up are all potential causes of chronic injuries. So we're going to go ahead and look now at soft tissue injuries followed by hard tissue injuries. So hard tissue injuries are in any injury to bone, joints and cartilage. So chronic hard tissue injury is an injury that, let's have a look, is an injury that's slowly developed over a period of time, that's resulting from continuous stress on the body associated with overuse, and it results in an injury to bones, joints and or cartilage. So a really good example of this is a stress fracture. We looked at open and closed fractures when in the acute injury video. Here we're looking at stress fractures because a stress fracture is obviously, it's built up over a period of time, so it's a chronic injury. So they're usually caused by fatiguing muscles that transfer the stress then onto the bone, and that comes through overuse and repetitive strain. Usually occur in the lower parts of the body because these are the parts of the body that are receiving the stress, caused by overtraining, increasing intensity too quickly, and using incorrect equipment such as maybe wearing incorrect training shoes. A runner, the impact, they take about 100 steps per minute, a runner in training, and about 3 to 4 times a person's body weight is the weight or the load that's going through the lower limbs each time those limbs hit the floor. So we can imagine over a period of time that repetitive stress on the lower limbs can end up in these stress fractures. Symptoms would be pain during exercise and swelling, and we can see some common sites of stress fractures there in the metatarsals in the feet, tibia and fibula towards the ankle, a bit further up the tibia, that's a common site there, and we can see also an MRI scan that's showing a stress fracture in the metatarsal there of the foot. So just thought we'd have a quick look at treatments of the stress fracture, because this is one of the injuries that we need to know the treatment method for. So just a quick roundup: must be diagnosed by a medical expert. You would use ice to treat the swelling and reduce pain. The person would be encouraged to rest for at least 6 weeks, maybe immobilise the area through the use of a splint or a brace, maybe using crutches. to take non-steroid anti-inflammatory drugs in order to reduce pain and swelling, and will gradually need to return to exercise, and not forgetting those all-important strengthening activities to strengthen those surrounding connective tissues. Okay, and then we're going to have a look at the soft tissue injuries. So any soft tissue injury is injury to skin, muscle, tendons and ligaments. So our chronic soft tissue injuries is an injury that's brought about over a long period of time due to repetitive strain, often associated with overuse, and it's an injury then to skin, muscle, ligaments or tendons. So shin splints is a good example. Shin splints is like an overarching term for all chronic shin pain. And it's because of the excessive loading. So it's similar, it's caused by a similar thing to shin splints, but this time this is damage to the tendons. So it's damage to that connective tissue where the muscle attaches to the shin bone through a tendon, and those tendons become inflamed. There are loads and loads of injuries, chronic injuries that are really closely linked, that are all referred to as shin splints. A common specific shin splint injury is medial tibial stress syndrome, or MTSS. Symptoms would be pain, swelling, potentially discoloration. And we would treat it generally the same as a stress fracture as well: ice, anti-inflammatory drugs, rest, immobilisation, slow return to exercise. And secondly, for our chronic soft tissue injuries, tendinosis, this is a really common mistake: tendinitis, tendinosis. Tendinitis is an acute injury to tendons. Tendinosis is a chronic injury to tendons. So tendons are those thick fibrous tissues made up almost wholly of collagen, and in tendinosis that collagen gets deteriorated over time due to overuse. Repetitive strain causes these small injuries in the tendons that don't get time to heal, and over time they accumulate and can make the tendon really quite irritated and sore. Symptoms will be burning, stinging, aching, tenderness to the touch, and stiffness. And some really specific and good examples are Achilles tendinosis, like Achilles heel. We can see a picture of that at the bottom there, just showing where the tendon's becoming inflamed, where the gastrocnemius and soleus are attached to the other side of the ankle. And tennis elbow as well, a good example of an overuse injury in the tendon that is felt by a tennis player or a golf player, golfer's elbow. Any activity where it's a repetitive action, it's the same action being performed over and over and over again. All of these could result in tendinosis. Okay, and that's it for our chronic injuries. It's a good idea, because I've given you excuse me, a little roundup of the treatment of stress fractures. It might be a good idea now to go and look at the other treatments that we looked at. Remember, we need to know how to treat fractures, so simple fractures and stress fractures, joint injuries, specifically dislocations, sprains and torn cartilage, and also exercise-induced muscle damage. So why don't you take yourselves off now, have a look at your notes to remind yourselves of those treatment methods for fractures, joint injuries and exercise-induced muscle damage.